right, guys, welcome back to another episode of the Live Loud Life podcast. I am with Nicole Schremp. She is a pediatric physical therapist. We just wanted to have a conversation and chat around what pediatric PT could look like, some of the common things to look for that might indicate or warrant, a consult or a conversation with a pediatric physical therapist. She's at Children's Hospital here in Denver. Excuse me. For those of you who are local and want to have a conversation, but I'll let you introduce yourself, talk a little bit about, your history, what drew you to pediatric physical therapy, so on and so forth.
Awesome. Well, thank you so much for having me. It's an honor. So as we talked about, I am a pediatric physical therapist. So I completed my Doctor of Physical Therapy at the University of Colorado. And while I was there, I actually had my first clinical in pediatrics. Really had no idea what this field was. I came into school thinking I was going to go into sports. During the first clinical, I literally fell in love with the population. I have always had this motherly instinct and loved like babysitting and being with kids. And then once I found out PT and I get to play with kids all day, it was wonderful. I continued to explore different avenues throughout school. However, kind of circled back to my last clinical, I went down to Texas Children's and was inpatient there. And it really just solidified that I wanted to work with pediatrics. Knowing that, I also knew how much more there was to learn. I was like, we only got so much when we were in school. So I applied and was able to complete my pediatric residency after I graduated. So that just gave me so much more exposure and experience in all different settings. It was a 13-month program that just finished last July. So I feel so fortunate to have continued my learning, and every day I just have more and more questions and literally love what I do.
That's amazing. So now, at least for me, and I think for most people, when they hear physical therapists, they usually think about, well, something hurts or post-surgical, right? So like I had surgery, I'm supposed to go to a physical therapist. So how would this conversation differ? And obviously kids do get injured and unfortunately have to go through surgery and things where that would be applicable. But my understanding is your role is separate from those, correct?
Yeah, that is correct. So I do a lot more with the developmental side and children. As a pediatric physical therapist, just broadly, we work with children and families. We want to assist the child in reaching their maximum potential in whatever capacity that is. The goal is that they can be active participants like in their home, in their school, and in their community. So we want to make those everyday activities easier for kids. This can range from a child who might not be hitting their milestones as the CDC puts them out there. We know that all kids have different trajectories in development, but sometimes some kids need a little bit more help to start rolling or walking along those lines. And that's more of that early intervention. Through the hospital now, I am in a more developmental role. So children that have longer term care in the hospital, they can't leave for one reason or another. I am helping them with those opportunities, giving them more opportunities to work on their sitting and their rolling and all of those foundational moments and movements that we need later in life.
So obviously in a similar field and understanding this, but for listeners, and we had I had a conversation via Messenger with a pediatrician at one point when the CDC took out crawling as a necessary developmental milestone. We're not going to get into the details of what the conversation was, but why are rolling, crawling, and these types of things foundational? Why are these important for the listeners or parents? People are just like, oh, it's okay, they didn't crawl, they'll be okay.
Well, in a broad sense, we want kids to have opportunities. We want them to move and explore their environment. So whether it's them developing strength or improving their range of motion, or crawling really helps develop those fine motor and all those arches of the hands and helps open up our hands in preparation for different activities. So all of those different areas, I really want a child to develop that symmetrical strength and range of motion. And we also need to be able to weight shift our body when we're little, which we don't think about, to move forward and back or side to side and be able to catch ourselves, which helps us start with that balance. It's going to help develop core strength as we're moving in and out of, our base of support. So where do we feel really stable, but are we able to go out and go get something and then come back without falling? All of those different pieces are going to be really important to start developing for children, so that they can, when they're older, be able to do what they want and move around well.
Yeah, no, I think that's such a good explanation of it because I mean, when you look at and I've heard multiple people say this in a number of different ways, but rehab
Hmm.
training, whatever that might be, is really just an extension of training in general. Because when you're talking about adults, it's really no different. The more exposure you have to certain things makes you well rounded and better able to handle situations.
Hmm. Yeah, that's it. That's exactly it. As pediatric PTs, we play. We do so much play with children. We just are trying to give them opportunities to explore their environment, that they might not be either getting because they have an injury, or we have to teach families to help them really learn how they are involved in their child and how we can make these activities functional and really fun. But parents are really the driving force behind who we collaborate with.
Oh yeah, for sure. I mean, kids aren't going to do it on their own, right? So when you're having, let's say, for instance, you're at a barbecue, you're at whatever else, having a conversation with somebody. What are some of the things that you encourage people to look out for that might indicate outside of a pediatrician saying, "Hey, it looks like we're behind on certain things"? Because with a lot of things, there's silent or subtle markers or indications that something might be going on where obviously better to intervene before it starts to develop into obviously a poor pattern.
Hmm. So that's, it's a broad question, but also not. So I think some different things, especially if we're thinking about a child and their development. So what does that 0 to 12 months kind of look like when we're supposed to be able to roll and be on our belly and lift our head and sit? All of those as kind of progressing to help us walk and move. So some things that, we're looking for, we want a child to be, when they're on their back, like kicking their arms and legs against gravity and like kicking them in a symmetrical pattern. So we have both arms and both legs are be able to move. They're able to bend and straighten and bend and straighten. That's not only showing there's the good range of motion, but it's also showing they have some strength. They're actually moving their body against gravity, which for them is a little bit heavier than it is, for us.
Hmm.
We're also, thinking about, if a child is standing, that they're able to stand and kind of move their body side to side versus are they only standing on their left leg? Like maybe they're not strong enough to move back and forth. So some other pretty common ones that we're hearing more about are children just, do they only turn their head to one side? Is there a flatter spot on one side of their head? So that's where, there's some different indications of torticollis or plagiocephaly, or, those more, I guess, like, is a child just only looking one way, or are we able to have full range of motion in our neck, to look both ways? So I think those are some of the big things that we're looking for. And some children just aren't as motivated to move as others. So is that a child? And if it is, like, that might be their personality, but how can we keep encouraging them to move and want to explore by giving them fun activities, or something that they really want to get to? Is a cause and effect toy really appropriate for them? So they hit something that lights up and they're like, oh my gosh, I want to do that again.
Yeah. No, I mean, and that's what's so interesting too. I mean, a lot of this is just obviously general observation, right? Because the kid is not going to be able to dictate and tell you if something's wrong or if they feel
Mhm,
imbalanced or pain outside of crying.
mhm,
But yet, I think just overall perception and awareness for our own bodies is something that
mhm,
a lot of us lack. So I think just paying attention is such a big important thing, not only to your own body but also to the kids to see what seems off outside of more serious things. Why do some of these things occur, like a strength imbalance outside of like a significant neural
mhm,
disorder, which would be obviously more prevalent or I guess uh, more prominent for someone
mhm.
to see. How do these strength imbalances occur in kids when you would think there's like, well, they're just a kid. Shouldn't they just be naturally doing these things?
Yeah, it can be a hard question. It can be sometimes kids are his families need them to maybe be in a carrier more, or they're in
Good
a
point.
nursing more, or they're not exploring as much, or sometimes they might just we might always hand them something on their left side, not even thinking about it, but we're only handing on their left side. Or sometimes however we lay them down, everything might always be on their right, so they might only be rolling to their right. So they're strengthening some core muscles in our arms and neck muscles only in one direction. So sometimes it just might be things that we're not even thinking about. But when it was kind of back to what you were talking about in terms of observation, so much of what I do my first session is just watching a child move.
Yeah.
So
Yeah.
the power of observation, of seeing what are their movement patterns, how are they moving, do they have a variety of movements, or some things that we run into in the hospital. We only walk in on one side of the room. So if a child's head is always to one way, they might only be strengthening, moving as they roll to the left, because that's where everyone is. That's where action is. Which could be true at home with changing tables or cribs. They might just environmentally get exposure more on one side than the other.
No, that's such a good point because I have this exact same conversation with individuals that have multiple monitors. That it's I have two monitors, but one's over here, and they got a catch in their neck because they only look right, they never look left, and or we just live in this world, we don't look out and around to create
Mhm.
more exposure. Do you Now, obviously, being a pediatric physical therapist, do you see any adults? Do you intervene with adults? And my curiosity with that is, and I'm not sure if you've heard, I'm sure you have, though, is DNS, dynamic neuromuscular stabilization. A lot of that's based on developmental patterns, where they use these principles to intervene even with adults and getting people back into developmental patterns to fix issues. Do you find benefit in what you're doing with adults as well as exploring these developmental patterns?
That's a great point. So ever since graduation, I've really been focused on PT. Or I mean pediatrics.
Yeah.
I have heard of it, but I don't feel um, like I can really speak to it right now, because that's not where I
Gotcha.
am. I'd be shocked if I wouldn't find it valuable for them, just because knowing what I know about kids. Um, so that's something that I do really have my niche right now. Most of the time, sometimes there are more adults with congenital or more pediatric diagnosis that I see right throughout the hospital, but most of the time I'm working with children more on that developmental side. So working on those early motor skills.
What's the obviously there could be put with cephaly and torticollis, like a fairly early intervention.
Mhm.
What's kind of like the I guess average range of kids' ages that you do see, or is it very broad and wide?
It's very broad and wide. I think I guess if I had to pinpoint, it would be like 0 to probably 5 right now is
Yeah.
most of what I'm seeing, at the hospital. During my residency, I spent time outpatient and did do some sports pediatrics. I also was in the school district at Cherry Creek, so I worked with first and second graders. So I have had that early experience. So from that 0 to 3-year-old all the way up to, 18, 19, 20, knowing that right now I'm back to the younger age group.
Now, for adults,
Mhm.
when and interestingly enough, sometimes when we're dealing with like a weakness issue, their body weight, as you had indicated for peds, which is different obviously based on the age, but their body weight is too much for them. Is there a
Mhm.
time where you're using resistance training outside of their own body weight, i.e., different modalities or bands or something like that?
When I was in the sports, kind of doing more ortho for 1 day a week for those 9 months when I was in the residency, we using a lot of bands, using different, probably very similar modalities that you would use on the chiropractic front,
Mhm.
but definitely ankle sprains or low back pain or rehab from a sports injury, all those things that I think when you think about physical therapy, it kind of is where your mind tends to go.
Outside of that, in your specialty of 0 to 5, it's pretty much just exploration, crawling,
Mhm.
groundwork, so on and so forth.
Yeah, it's a lot of, like, giving these children opportunities and making it fun and exciting, like, it's a lot of play, we want them to want to do the movements, like, I will do some facilitation to help them get into certain positions, but we've found more and more research of just, like, that cause and effect of them doing it, and we get
Yeah.
really excited, or, like, they roll, and we're like, "Oh my gosh, this is amazing," or they roll and they get some reward on the other side, whether they see a book, they see mom, or what that looks like. So a lot of it is just using the child and letting them explore their environment and that reward of clapping or some of those things, so they get really excited.
Is there any, I'm sure there is benefits, so I don't know if
Mhm.
this question's asked correctly, but if you do intervene with it, but is there advantages to doing soft tissue work in any situation to help facilitate, i.e.,
Mhm.
some massage or vibration to activate something?
100%. And I was just in a continuing education course over the weekend, looking at how breath really impacts the body's movement and core, and thinking about some of the children I work with have trachs and vents, so
Mm,
the top of their breathing, is impacted because that they have that open hole. So what can you do for rib mobilization or some soft tissue massage on the ribs to really help expand and improve breathing, which is also going to help in so many different ways.
that's interesting. Yeah, that's a really good point. What are a few things just I mean, obviously in our industry there's certain things that we want people to I guess myths to bust, if you will, but not even myths to bust, just like what are a few things that you think you're trying to get out that people should know about pediatric physical therapy?
Yeah, that's a great question. I think the big thing that I want people to know is encourage your child to explore. Like, it's okay to let them play on their own and be able to move around in their own environment. And it's also okay if you have some questions on things that might not seem right for your child to ask your pediatrician and really use them as partnership. If they're, think everything's fine and you just still have your like parent instinct that something's going on, reach out to a PT or look into early intervention if you're 0 to 3 years old. It's something that would be it's really great service for children with any sort of delay to receive services in their home. So I would just say if something doesn't feel right, ask, whether it's your chiropractor or another PT or your pediatrician. And if you don't get an answer, just continue to ask.
How might I mean, and this is such a funny question, I think,
Yeah.
because we kind of get the same. For adults, it's harder because creativity, especially in
Mhm.
that type of setting, is harder to intentionally elicit. But if play based is so important,
Mhm.
what things do you tell your parents? Now, granted, you're seeing them in an intervention status, if you will.
Mhm.
But what things do you encourage people to do? If play based is so important, how do you encourage parents to help their kids play more at home?
Yeah, so one thing is really just talking to parents. What is your routine at home? What does your day look like? And then how can we put little pieces into their day that you don't really think about as therapy, but it's therapy. So say diaper changes is something, and we're really working on some core strength. So we want parents after every diaper change to help the child bring their hands to their toes. So something, you're already bringing yourself, the child on their back. So we're really working on touching our knees or our toes in that position. Or does the child love bubbles? Like, let's play bubbles down in the hall and see if we can encourage them to crawl to the bubbles or to stand up to pop the bubbles. Putting little squigs on windows to have them stand there and just pull off the little squigs. It's really a ton of core strength and balance and reaching. So there's a lot of different play-based activities that we can get really creative with, and really seeing the big piece is like, how does it fit into their life and their routine? I don't want to give parents a laundry list of homework. I want to give them some things that they are like, oh yeah, we basically do that, but I can tweak it this way, and that's actually going to help their child, their individualized program of whatever that child needs, to get stronger or more, whatever's like developing those skills.
And I think that's such an important way of getting at it, because we say something very similar, right? It's like oftentimes what we're doing is no different than what you're already doing, but the
Mhm.
intention of how you're doing it
Mhm.
just changes slightly, and that makes the world a difference.
Totally. I love that how you said that. The intention. Yeah, that's exactly it. We're making it fun and enjoyable, but there might be a little different tweak to really help us get that result that we're looking for.
Yeah,
Or the child is going to start doing something just a little bit different, and parents are like, oh my gosh, this is wonderful.
yeah, that's awesome.
Yeah.
Um, I think that's all. I think that's amazing. Like because obviously there's extenuating circumstances of more serious conditions that
Yeah.
require a lot more, obviously one on one. But for the general type of public of having these things, most kids are doing fine with it because they have this natural exploration. But making
Hmm.
it fun and, and
Hmm.
and seeing the games can also highlight certain things. I mean, I know for our kids, we talk a lot about like they naturally like, oh, I'm gonna pretend like I'm a dog, and you're
Yeah.
seeing how they crawl or do all these other things, and you
Yeah.
can really start to see discrepancy, so on and so forth. So that's a lot of great information.
Yeah.
I honestly I learned so much. I don't have a lot of other follow up questions. I think this has been wonderful for to share and to give people an idea, especially and not to because I think there's a number of great pediatricians out there, but I think a lot of times these in our world, these movement based things of what we
Hmm.
find to be super important sometimes just
Hmm.
get swept under the rug.
Yeah.
They'll grow out of it is what we
Hmm.
commonly hear, right? Uh, but my thought is, well, maybe, but we might as well optimize them so that they can be interactive with their peers at
Yeah.
school, at home.
Yeah, I think that's the big piece. We just want the child to participate with their family, friends, and school environments. And um, you're right, they might grow out of them, but they might not. And why not get evaluated by, whatever setting that is? If it's a PT, like to have a PT just do an evaluation and see where they are. Some other ones that we hear a lot of that they might grow out of is toe walking. So we
Mhm.
definitely, that's one that I didn't bring up before, but something to be on the lookout for. So anything a child does all the time that it's their only way of moving. W sitting is another one. So it's okay if we're, going in and out of it or using it to transition, but if we
Mhm.
can't move outside of sitting, in a W position, or we're only looking to our head to one direction, or we're only walking on those toes. It's kind of when we get siloed, um, that's something that we definitely want to look at. We want just kids to move. We want that variety. We want them to just do different things in different ways.
No, that's such a good that's a good point too, because I think I think it's kind of hard to say sometimes, like, well, what's normal? It's like, well, when you look at anybody
Yeah.
walking, we all pretty much walk the same way.
Mhm.
And when you see something else, like, well, we kind of use general common sense. Like that doesn't seem natural to how everyone else moves or
Mhm.
walks. Same with crawling or scooting.
Yeah.
They're like, well, they get around fine. Well, yeah, because they can. Like we're the other example that we commonly use is like humans are very task oriented, goal driven. As you said, I want to
Yeah.
do this because I get a reward.
Mhm.
We're no different. If the task is to run a mile, you're going to figure out how to do it, regardless if it's efficient or not.
Right. Yeah, and that's it. Some kids, there's so many different ways of crawling. If you like look on the internet or research, there's like, I mean, so many different ways. We would ideally like a child to hands and knees crawl because they're getting symmetry, they're getting reciprocal movements, they're strengthening both sides. Some of these other ways of crawling, the child is efficient, they're getting around, but
Yeah.
they might only be strengthening one side, or they might be putting one side of their body in a less optimal position. So we want the reason they're doing that is they figured out how to move and get that reward, but we want them to let them keep going, but we also want to strengthen and work on whatever other piece there is to that.
Yeah. Well,
Yeah.
I appreciate the time. This has been extremely helpful for me as well, and obviously good to always see like what are certain things that are coming up that are it's like, hey, that's a hard conversation too sometimes. Like this doesn't
Yeah.
look normal, but
Yeah.
it's worth asking a few questions and knowing who to talk to. Is there anything else that you would like to leave people with that has come to mind that maybe I didn't ask a question about?
I think that's it. I really, just to circle back, let your child explore, be able to have fun and play, inside, outside, all of those different areas, and just trust your instinct. If you feel like you want to ask some questions, please do.
How can people reach out to you if they want to work with you or anything like that?
Yeah, I would love to hear from you with questions or anything. So I have an email address that I'll pass along, that we can put in the show notes. Nicole.c.schrempdpt@gmail.com. It's a little bit of a handful, so we'll just put it in the show notes and
Yeah.
have it be there.
Well, perfect. I really want to appreciate you taking the time out of a busy day and chatting with us and sharing your knowledge.
Awesome. Thank you so much. One last piece that I
Yes.
want to put in the show notes too. If you have questions on milestones,
Oh, good.
pathways.org and the CDC has different avenues for milestone trackers and milestones.
And then for early intervention, because this does come up every now and then, where would one reach out to, or who should they be researching or looking out to for those early intervention resources?
So early intervention is the federally mandated program. So it's like support for an education for children, with developmental delays in their families. So it's anyone from the 0 to 3. You can go on, and I think if you just type in early intervention, there's different community center boards.
Okay.
So you want to reach out to your community center board or ask your pediatrician for a referral.
That's perfect. Yeah. So yeah, pediatrician be a good resource. Early
Yeah.
intervention. Yeah,
Yeah.
that'll come up.
Yeah.
Well, thank you so much. I really appreciate the time and chatting.
Thank you so much for having me.
Of course.